This is a race. We are racing to get as many people vaccinated as quickly as we can, ahead of what could be this super contagious strain.
Turning now to the coronavirus here in our state, a renewed urgency to get vaccinated as more cases of the highly contagious UK strain of the virus emerge.
The state confirms right now we do have 8 cases, but there are likely many more. Channel 3 Eyewitness News reporter Matthew Campbell is joining us now live. And Matthew, what can we do about this?
Yeah, Aaron and Mark, that's the unsettling thing here. Doctors say there's really nothing new that we can do to protect ourselves from this strain, and that's why the rush is on to get more doses of the vaccine.
The massive vaccine rollout in Connecticut is still going strong. We're still in the top 5 in the country, and 27% of those 75 and up have received their first dose.
Total doses administered, 300,000 and counting. And I think that is progress.
The progress comes at a time when the coronavirus is mutating and moving into Connecticut. The UK strain has been confirmed now in 8 people, some living in separate households.
I think we're assuming that it's much more widespread than you see just in those 8.
Testing for the UK strain is complicated, and that's the reason there's not better data out there. When you get tested for the virus, you get swabbed, and the sample gets sent to a lab. Testing for the UK strain adds another layer.
We'll receive literally the same vial, the same tube with the swab that comes to our lab.
Dr. Joseph Falver is part of roughly 15 at the Yale School of Public Health tasked with digging deeper into the positive tests. Each one takes more than a day to complete.
We do what's called next-generation sequencing, which is just a technique that allows us to read all of the letters of the SARS-CoV-2 genome.
Dr. Falver says the UK aims to test 5 to 10% of all coronavirus cases looking for the new strain. We're doing a fraction of that in Connecticut, but that doesn't mean trends won't become apparent.
We're doing this every week. We can say, week 1, we found 4 cases. How many did we find in week 2? How many did we find in week 3, week 4, week 5, to see if we are seeing that rapid proliferation.
Because this type of extra testing is so technical, it seems like this is how the state's going to be gauging the UK variant going forward. But Dr. Falver did bring up a good point. He says, yes, this is more contagious, but that doesn't mean it has to be. He says, combined with the ongoing vaccination efforts, if we do keep wearing the masks and do the social distancing, we can all play a part in controlling the spread of the virus. Live here in studio, Matthew Campbell, Channel 3 News.
Yes.